Today we are going to discuss regarding the deep structures of neck. Deep structures of neck. This is a revision video, so something maybe a mistake, but I am going to cover all the topic. Like we have first discussed subclavian artery and vein, arteries and vein. Then we discuss carotid sheath, carotid artery, and internal jugular vein, and deep structures of the neck. There is a content of like trachea, esophagus, and thyroid gland. So we are not going to discuss in this video. These are this topic like trachea, esophagus, and thyroid gland are covered in the specific systemic or the another portion of the lectures. So we need to discuss internal jugular vein and vagus nerve. In this video, but in the content we can write trachea, esophagus, and thyroid gland. After that, we discuss anca cervicalis, and in another period we discuss other portions like cervical, sympathetic chain, cervical, sympathetic chain, then stellate process, and then deep cervical lymph node, deep cervical lymph node. These all are the contents, lymph nodes. These all are the contents of the deep structure of the neck. So moving on the subclavian artery. Arteries and its branches. So supply of the upper limb, there is a subclavian artery which is supplied to the upper limb like our arm, hand and arm, forearm. In this region, it is supplied subclavian. It is supplied by subclavian artery. So when we look at the origin of the subclavian artery, so it is originated from the right subclavian artery. Right subclavian artery is arises from the brachiocephalic trunk behind the right sternoclavicular joint and at the root of the neck. When we look at the image, like when first it's right and left, and there is a right subclavian artery. It is originated from brachiocephalic trunk, and at the region of like where the sternoclavicular joint present, and at the root of the neck. And when we look the origin of the left subclavian artery, it's originated direct from the arc of aorta and in the thorax. So it's run upward and it originated from the like arc of aorta, and it is initially situated in the thorax and run upward, and at the left mediastinal pleura, and it makes the groove on the left. When we look at the lungs, there is like a groove, left lung, and there is a groove for the left subclavian artery. and enter into neck by the passing behind the left sternoclavicular joints. Like when we look at this image, in the there is like this is a left subclavian artery, and this left subclavian artery, direct originated from the arc of aorta, and here is the groove for the here is the lungs, and in the lungs here is a groove. So it's go upward, and it's like it's stay in the media sternal pleura. And when we look at there is a groove for the left lung, and like it's passing through the neck by the here is the joint for the where we look at there is a joint for the sternum. Like in this region there is a sternocleidomastoid joint. This region there is a sternocleidomastoid joint. So passing through, after that there is a sternocleidomastoid and go in the axillary region. And for the right, it is there is initially origin from there is a like brachiocephalic artery, and brachiocephalic artery gives the right subclavian artery, and the common carotid artery, but right common carotid artery, but left common carotid artery direct originate from the arc of aorta. So moving on the course of this course, on each side of subclavian artery arches laterally across the anterior surface of the cervical pleura onto the first rib of the posterior to the subscleneus anterior muscle. Like, and it's terminated at the outer border of the first rib, where the subclavian artery continues as a axillary artery. Like when we look in this image, like subclavian artery going and like both sides, and there is like anterior surface of cervical pleura. It is stay on the in the posterior side. There is a pleura, cervical pleura, and like the ribs of the posterior scalenus muscle. This is the scalenus anterior muscle, and scalenus anterior muscle is like divided, and on the at the outer border of the like first rib, where the subclavian artery continue. Like this subclavian artery after that continue as an axillary artery. This is subclavian artery, and this is axillary artery in the axilla. So moving on the branches of the subclavian artery, branches of subclavian artery. So from the first part, it is divided into three parts. So we are going to discuss in that manner, like first part, second part, and then third part. In the first part, there is 4 branches. In the first part, there is 4 branches, and in the second part, there is only 1 branches, and in the third part, there is only 1 branches. So we are going to in the first. There is in the first part, there is a like vertebral artery, vertebral artery originates from the first part of the this subclavian artery. Then there is a cervical trunk, and each cervical trunk gives another branches like inferior thyroid artery, then it's give a transverse cervical artery, then it gives suprascapular artery. When we look at the third branches of the first part of the subclavian artery, there is the internal thoracic artery, thoracic artery. And when we look at the like fourth part, there is a costo cervical trunk, and on the left side only, it is present only left side. So now we are moving on the second part of subclavian artery. So second part of subclavian artery, costo-cervical trunk. It gives costo-cervical trunk on the right side only. Costo-cervical trunk, the right side only. Moving on the third part given one dorsal scapular artery. Dorsal scapular artery. Now we are moving on the image. So in this image we can look first part. This is first part. After that first part, then there is second part and third part. So this is second part and third part. So moving on, first part, second part and third part. So when we look in the first part, there is a vertebral artery. This is a vertebral artery. In the first part, this is a vertebral artery. Then in the first part, there is a trunk. So this is the thyrocervical trunk, and here there is an internal thoracic artery. And when we look at the left side, in the first part, there is a costo-cervical trunk. But in the costo-cervical trunk, in the second part of the right side, when we look in the right side, there is second part and costo-cervical trunk. Then there is in the thyrocervical trunk, there is some other branches. Thyrocervical trunk gives suprascapular artery, then transverse cervical artery, and it's continued as the inferior cervical artery. And when we look at the second part we have already discussed costo-cervical trunk give in the second right side. But when we look at the third part give dorsoscapular artery. These are the branches. So now we are moving on the vertebral artery. We discussed the subclavian artery. Now we are going to discuss the vertebral artery. Vertebral artery. Vertebral artery. It is the first. It originates from the first part of the subclavian artery. First part of subclavian artery. And when you look at its courses, it ascends through the transverse foramen and upper six cervical vertebra, and it's wind backward around the lateral mass of the atlas and in the suboccipital triangle, and it passes the post anterior OM. Like we look in this image. It is like 6 and enter in the cranial cavity through the foramen magnum, and it passes dura mater, acute mater, and each artery passes upward and medially in the front of the medulla oblongata and joined and courses artery of the opposite side and caudal border of the pons, and it's from the basilar artery. After that, when we look in this image, this is the after the origin. It's go and penetrate inside the transverse portions of the cervical vertebra, and like sixth, it's go up to the sixth cervical vertebra, and after that it's go posteriorly and come into anteriorly, and it passes through the foramen of magnum, and before that it gives some branches we discuss later. So, and it continue as a basilar artery in front of the medulla oblongata, and go upward, and it also forms some branches. So we discuss some branches in the later. Now it is divided into like four part. First, this first is like before the penetrating the transverse process is known as preforaminal. After that, sixth up to sixth cervical vertebra, it is known as foraminal. After that, it's going to the see to the durameter. So passes the durameter, so it's known as the V3. And after that, it passes into intracranial. From here the cranium start. So intracranial, known as V4, intracranial. Then there is a basilar and the posterior cervical arteries. These are part of the cervical. Sorry, these are part of the vertebral artery. Now moving on the branches of this vertebral artery. So its branches in the neck. There is a cervical branches. So in the cervical branches, like known as spinal branches and muscular branches. It gives branches like spinal branches and muscular branches. But in the cranial cavity, it gives four part. It gives the like meningeal branches, posterior spinal artery, anterior spinal artery, and posterior inferior cerebral artery, medullary branches. These are the fourth part. Like this is the fourth part, intracranial, and from the intracranial there is some branches. So I am going to write the branches. Better to branches. So it is divided as cervical branches and the cranial branches. Cervical branches and there is cranial branches. When cervical branch, there is the spinal and muscular branches. Spinal branches and muscular branches. When you look at the cranial branches, it is like fourth part of the vertebral artery. Fourth part. So in this there is a meningeal branches. Then posterior spinal artery, posterior spinal artery. Then there is anterior spinal artery, Then there is posterior inferior cerebral artery, pica. Then there is medullary branches. Like when we look, this is the vertebral artery, and when it's going inside the cranium, like it is going in cranium, so it gives two posterior branches. After that there is the anterior branches. These are the spinal, posterior spinal artery, posterior spinal artery. This is anterior spinal artery, anterior spinal artery. Then then it forms the basilar artery, and before the basilar artery there is the two posterior. So it is pica, posterior inferior cerebellar artery, and then after that is from the basilar artery. From the basilar artery is from the medullary branches, and also is from the anterior. From the basilar there is a anterior this from the anterior inferior cerebral artery, and then it's go inside the more upward, and it's from the posterior cerebral artery, posterior cerebral arteries. We are moving on the cervical thyrocervical trunk. We discuss here. There is a thyrocervical trunk. So regarding this thyrocervical trunk, because it is like a short and wide branch of the subclavian artery, and when you do the origin cause termination, like it arises from the upper aspect of the first part of the subclavian artery we have discussed, and at the medial margin of the uh, at the medial margin of scalenus anterior and the lateral to the origin of the vertebral artery. Like after the vertebral artery is formed, and it's immediately terminated into three branches. We already each terminate. This is the common carotid artery. Common carotid artery. So this artery. This is the thyrocervical trunk. This is known as thyrocervical trunk, and when it is give this, and there is like some branches. Thyrocervical trunk has branches: inferior thyroid artery, transverse cervical artery, and suprascapular artery. So moving on the another. This is this artery. This artery is known as this artery. This artery is known as suprascapular artery. Suprascapular artery, and after that it's go upward and also form a branch. This is known as transverse cervical artery. This is transverse transverse cervical artery, and after that is from the inferior thyroid artery. Inferior thyroid artery. Inferior thyroid artery. These are the arteries. So after that there is ascending cervical artery. Ascending is also a branch of this ascending cervical artery. Ascending cervical artery. Just regarding the thyrocervical trunk. So after that there is inferior thyroid artery. So moving on the inferior thyroid artery. Inferior thyroid artery, and this like it ascends along with the medial border of the scalenus anterior, and it's just below the transverse process of the just below the transverse process of the cervical vertebra 7, and it's turned medially to the reach the posterior surface of the lateral lobe of the thyroid gland. Then it descend, like first go ascending and then descend, like go ascend and descend. The descent we look in this image also. Here ascend and descend. So it descended, and lower pole of the thyroid gland, like this is the butterfly shape of the thyroid gland. So it's lower pole of the thyroid gland and lower pole of the thyroid lobe, and it divides the ascending and descending glandular branch. Like it's also divided into ascending and descending glandular branch. So it has branches like glandular branches of these branches. There is two type of branches. One is glandular branch, then there is other small branches. So there is the ascending cervical artery, inferior laryngeal artery, and tracheal, pharyngeal, and esophageal branch of the trachea. These are the branches of this. So ascending cervical artery. Then there is inferior laryngeal artery. Then there is tracheal, pharyngeal, and the esophageal branch of trachea. Tracheal, pharyngeal, and esophageal branches to the trachea and pharynx, esophagus respectively, and trachea, pharynx and esophagus. So inferior laryngeal artery supply to the mucous membrane of the larynx below the vocal cord and the muscle of the larynx. And when the thinking about the ascending cervical artery, this ascending cervical artery supplies the prevertebral muscle and send the spinal branches to the vertebral canal along with the spinal nerves. So when we do the other branches, like there is a transverse cervical artery, inferior laryngeal artery, and tracheal esophageal artery we have discussed. Now moving on the costocervical trunk. This costocervical trunk. So when you look at the origin, it arises from the posterior aspect of the first part of the subclavian artery, and when the second part of the it is in the left side. So in the left side there is the first part, but there is a second part. In the second part of the subclavian artery of the right side, and we have already discussed right side. So there is the course and termination. So the artery arches backward above the cupola of the pleura and reaches to the neck and the first rib, where it is terminated by dividing the ascending deep cervical artery and ascending superior intercostal artery. So we need to discuss regarding the branches of this. So there is terminating it divided into two branches. One is ascending deep cervical artery, and another one is ascending superior or higher intercostal artery. This is regarding the costocervical trunk. Now we are moving on its branches. We have done with the branches. Now moving on the dorsal scapular artery. So dorsal scapular artery. Regarding this, is the third part of the subclavian artery. Third part. And when you look the courses, it's like it passes to laterally and backward between the trunk of the brachial plexus, and to reach the underside the labral scapulae, and descend along and the medial border of the scapula, and in the company with the dorsal scapular nerve, deep to the rhomboid, and take part in the formation of arterial anastomosis around the scapula. It go posteriorly and with the nerve of the dorsal scapular nerve, and go in the deep to the rhomboid, and it take a part of the formation of an arterial anastomosis in the around the scapula, like it supply scapula, and passes with dorsal scapular nerve. Now we are moving on the our common carotid artery, and then we discuss regarding the carotid sheath. So regarding common carotid artery, our topic is common carotid artery. Like it is a chief artery that supply to the head and neck. So when you look at the origin, there is the origin of the right origin origin. So there is a right and left common carotid artery. So the right is originated from common carotid is originated from brachiocephalic. We already discussed cephalic trunk, and like innominate artery, it is known as innominate artery, and behind the where it is originated, it is originated from or the behind of the sternoclavicular joint. Behind sternoclavicular joint, clavicular joint. When you look at the left common carotid artery, so it is arise from the direct from the arc of aorta, and it passes ascend to the back part of the subclavian and go upward and ascend and back of the left sternoclavicular joint and enter to the neck. So it is superior medial sternum. It is present in the superior medial sternum, and as same as it's also behind the left sternoclavicular joint, and it's go into the head and in the neck. So when you look the courses in the neck and other region side, and so in the neck it is each arteries run upward from the sternoclavicular joint to the upper border of the lamina of thyroid cartilage and opposite of the disc between the third and fourth cervical vertebrae. When you look image, so you can discuss there is third and fourth cervical vertebra, and where it's terminated by divided into the internal and external carotid artery. Like in the neck, in the region of third and fourth cervical vertebra, and cervical vertebra 3 and 4. So there is a region where it's divided into the external and internal. This is the common carotid, this is the external, this is the internal carotid artery. This is a common carotid artery. So when you look the each common carotid artery lies front of the transverse process of the lower fourth cervical vertebra under the cover of anterior border of the sternocleidomastoid muscle. Like when you look at the common carotid artery, this region. It lies 4 cervical vertebra. Transverse process, here is a transverse process, so it is situated in the transverse process of 4. So when the branches is give the external and internal branches we discussed. Now we can move on the there is a is a clinical implication, we check the carotid pulse at the common carotid artery. So at one times we can check only one sided of the carotid pulse. We can check both sides of the carotid pulse. We can't check the both sides of the carotid pulse at once. Now we are moving on the external carotid artery. External carotid artery. So external carotid artery. It supplies the structure external to the head and neck, in front of neck. Like it's when you look at the course and the relation, its external carotid artery extend upward from the level of upper border of the lamina of the thyroid cartilage to the point behind the neck and the mandible. And when it terminates in the substance of the parotid gland and divide into the superficial, temporal and maxillary artery. So it has a slightly curved course that is the anterior-medial to the internal carotid artery and are in the lower part, and the anterolateral it to the internal carotid artery is upper part. One of the branches of external carotid artery, In the branches, we can write as there is superior thyroid artery, superior thyroid artery, then lingual artery, then there is occipital artery, then there is posterior auricular artery, posterior auricular artery, then there is ascending pharyngeal artery, ascending pharyngeal artery, then there is maxillary artery, then superficial temporal artery, superficial temporal artery, these are the branches. So when we look to draw the image, like this is our internal carotid artery and this is external carotid artery, and when it draw, this is going upward and it's forming maxillary artery, and that is forming the another is directly superficial temporal artery. These are two arteries. Before that, there's in the region of the after dividing the external internal artery, that is also give. Here is the keeping of the superior thyroid artery. This is superior thyroid artery. Then in the middle side there is another. This is non-ascending pharyngeal artery. It's going upward. Ascending pharyngeal artery, and it is middle branch. So after that there is two. This is the like lingual artery, and one is here is the facial artery, and then there is a two. After that there is a two posterior branches of the, like this is occipital artery and this one is the posterior auricular artery. This is posterior auricular artery. This is occipital artery, posterior occipital artery, and this is ascending pharyngeal artery, and this is internal carotid artery, internal. This is superior thyroid artery. Then it is the lingual artery, and this are known as facial artery. These are the images. So after that, in the another video, we will discuss regarding the other portion of the